Hi everybody, this is Tony, and it is April. It's Thursday, first week of April. I'm just making a general update. I am just about 2 years post-op now, almost hitting my anniversary, and I have been maintaining my weight at 188 for over 6 months, and I must say quite easily for me. Thank you. I follow the rules still. I'm not perfect. I've never been good with water, both drinking enough of it or not drinking it at the wrong times. I've always been bad at that, but so far I'm not the worse for wear. What I have been super strict about is my vitamins. I never miss them. Not one. Actually, in almost 2 years now, one day I missed the vitamins, and that was the day I was in Houston with the surgery. It was just such an intense day. I don't think I had any water or vitamins or anything. We ate lunch with Trudy, and that was it. And it was just this crazy, crazy day. But aside from that, I've never missed my vitamins, and I think that's vital to stay healthy. There's so many things that can go wrong if your vitamins get out of whack. So don't take the chance. Make sure you eat your multivitamin every day. I eat an extra chewable vitamin D. I eat my calcium. I eat my B12 on sublingual. And, that's without fail. I also stick to the rules of 3 meals a day and 2 small snacks, and they have to be healthy snacks. So I don't deviate from that. And occasionally, when I'm traveling or here or there, or you go out to dinner, maybe you make choices that you wouldn't at home. But I think if you just stick with 3 meals a day and try, and the grazing, I think, we should have 2 t-shirts we all wear. One says, eat your blanking vitamins. The other one should say, no blanking grazing. Okay, because those will, I don't care which weight loss surgery you've had, grazing is not your friend, okay? I've had people say to me, oh yeah, I just eat a little bit all day long. That is the worst possible plan anybody could have, even if they're not weight loss surgery people, because that's called mindless eating. You don't even remember what you ate. You have no idea how much you're eating, if you're getting enough protein or not. So really 3 meals a day. Okay, that's my lecture. I really miss my friend Rosemary. She's with her sister, as you guys know, in Dallas right now, and helping Connie get on the right track and do all the right things to have a successful journey. Tomorrow, Connie told me on the phone that she's going to do Friday weigh-in, so that means tomorrow's her second weigh-in. Her first weigh-in, she lost 16 pounds. That's outrageous, right? Poor thing was on a liquid diet for like 5 years. Anyway, no, not that long, but a long time. Luckily, I now live in the same town that my best friend works, so we get to see each other all the time. Hey, Amy, I love you. I've been super, super busy since, with the whole Houston thing, and then every weekend I've been at track meets. Our son, David, Jim's youngest son, he's 19, he's a freshman in college, he's on the Cal Poly NCAA Division I track team. He's a hurdler, 400 meters, and they're also using him on the 4x400 relay. So, we never missed a track meet of his. We never missed a football game. We have a lot of kids together, Jim and I, and a lot of the kids did sports, but he's the last one, so we try not to miss anything, because once he's out of college, and then we really, well, unless he becomes I don't think he's going to become a doctor, he says, and you can't go watch that, can you? Well, I guess you could, but I wouldn't want to. I would rather chew off my own foot than watch an operation. I remember when my husband, he had his LASIK done for his eyes, and they're like, do you want to come in and watch it? I'm like, no, I don't want to watch. Oh, I admire doctors and nurses and people that can handle all that stuff, but I'm not one of them. And it's so funny now, because here I was a human being when I was morbidly obese. Well, I should just say almost my whole life. I had a real phobia of medical things, hospitals, doctors, seriously. And now what do? I'm calling, I'm talking, I'm hanging out in hospitals. Excuse me, I'm calling doctors, you know, doctors are calling me. I'm always talking medical stuff, but I think it's really good because, you know, I had to face my phobia, my fear about doctors, and it was that fear that kept me from going to the doctor when I was really heavy. In fact, next week I get to talk to another doctor, Dr. Katz, not Katzin, not our fantastic plastic surgeon whom I can't wait to see again in Las Vegas. Do you know that Dr. Katzin donated up to 3 surgeries a year to us, to the foundation? I just hope, you know, when we get better at fundraising, we'll be able to fund, you know, because even with those 3 donated surgeries, we still have to pay the, you know, the medical facility fees and stuff. But he's willing to do up to 3 for us a year. I think that's amazing. But anyway, you guys might have seen that article he did about how doctors, you know, basically abuse their obese patients and say things to them that make them not want to go to the doctor anymore. And I was one of those people. And I loved his article so much, and he's a well-known, like I call him TV doctor. It's like he speaks on CBS, for example, and he has his own foundations, and he's really involved with childhood obesity, trying to prevent, you know, kids from ever getting obese. So I love what he's doing, and he answered my email right away, and so we have a meeting to talk next week, so that'll be cool. But what was my point on that? Oh, his article. It spoke to me directly because you know, like for example, when I was having my first baby, I was always heavy. So of course, when I had a baby, I got even heavier, right? And I had a cesarean with actually both my kids. But anyway, the first time, you know, you're laying there, you're strapped to the table, you've just had a baby, you know, you're not exactly you know, you're not really, you're kind of flung out there. You know, whatever happens, happens. And my husband's sitting next to my head and whatever, and it seemed like after the baby was born, I was there forever, and they were sewing everything back up, you know. And I was mostly talking to my husband, like, why is that it seemed to me like in my fog, like it had been hours. I'm like, why is this taking so long? And this doctor literally stood up, looked over the fabric, you know, that they hide your grossness away from you. And he's like, if you hadn't gotten so fat, it wouldn't take me so long to sew you up. Oh my God. I'm sitting there strapped down, right? Your arms are literally strapped down. Your legs are strapped down. I can't even kick the guy. I mean, I would have kicked him. I would have kicked him. The nurse, I remember the nurse who was standing by my head leans over and says, look who's talking, because he was heavy. But anyway, the point is that and other things were devastating, and I didn't, you know, and it added to my phobia. I hated going to the doctor already, and then, you know, when you get really big, you figure, oh, if I go in, everything's going to be wrong with me because I haven't been in 5 years, or I haven't been in 6 years, and it gets worse and worse, and then they're going to say, and plus you're fat, and that's why you've got high blood pressure, and they're going to blame everything. It's a whole big ball of ugliness, and it feeds into, especially if you have a little phobia about it, it makes it even worse. So for me, I had to face that, and it was a hard demon. It was hard. It was, oof. But I did, and it's what led me to where I am today, because I had to face that. I had to face going to the doctor. I had to see what my health was to be able to make a difference and change it, right? You can't get weight loss surgery without seeing a doctor. And so if there's anyone out there that would like to have this miracle, but they're afraid to see the doctor, you have to somehow screw up the courage to do it. You just have to do it. Or contact somebody on YouTube and let them know, and maybe they'll walk you through it. Somebody will hold your hand. I'm happy to talk to anybody that has that phobia, because I lived through it, and I know the only way I got rid of it was to face that monster head on, and it changed my life. It made it better, and you know, I feel like I'm living testament to that. So that was a heavy duty. I didn't mean it to be that way. Anyway, getting close to the meet and greet, getting super excited. It got sold out. We did good. For our first year, we did good. We're going to have 300 people there. I just found out today Fox News, you know, the Fox News in Houston covered Connie and Rosemary. I put that up on the WLSFA site and stuff. And I emailed the one in Vegas, the actually I emailed all the news stations in Vegas, but Fox News replied, and they are going to cover our meet and greet. So, you know, get ready to be on television or hide from the TV, whatever you want. But that's kind of cool. And, you know, and then we have our billboards that are going to be going on. We have digital billboards all over Las Vegas that whole week talking about the foundation. They say something like denied access to weight loss surgery. There is hope. Ask Connie Bailey, our 2010 grant recipient. Something like that. Anyway, we have a couple different ones. That's going to be cool. Some great speakers, amazing entertainment. Diva Tanya's Vegas Vixens. Oh my God, you guys get ready. This is a Vegas act. No children, okay? Do not bring children. Please do not bring children to the Saturday night party. It is not appropriate, okay? It's for adults, okay? And as far as the rest of the event should be pretty child friendly if you are bringing children. I don't know if anyone is. I think last year there were a few, but I don't know this year what's going to happen. But that Saturday night party is not, the show isn't appropriate. Afterwards it's just going to be mingling and dancing, so after that. But anyway, that's it for now. I'm just happy that we made it through the first surgery and I'm back home and kind of back to normal. And this is getting too long, so I'm gonna stop it now. Have a good one, everybody. Bye.